Hello, everyone, and welcome to the Arthritis Action Podcast. I'm Marc, your host for today, and on this episode, I'm joined by Dr. Wendy Holden. Wendy is an Honorary Consultant Rheumatologist at North Hampshire Hospital's NHS Foundation Trust, specialising in arthritis and pain management, and also the Medical Advisor for Arthritis Action. Hello, Wendy.
Hi, Marc. Thank you for having me.
Thank you for coming. I really appreciate it. So a few years ago at our AGM, I watched you do a talk on the unusual ways that they used to treat arthritis. And firstly, it was really good. I thought it was fascinating. And I thought it'd just be really fun to have like another kind of version of that, go through some of the stuff you talked on that for everyone else, because I had no idea about some of that stuff on there. And as we all know, the history of medicine is interesting, at least, shall we say?
It's really interesting, and it's a wild world out there.
Yeah, so some of the stuff it's insane. It's so unbelievable that some of it used to happen. But yeah, so I thought it'd be really cool if we could talk about some of that stuff. So before we do, though, if you could give us a little bit, just tell us a little bit about yourself and your role with the charity.
Okay, so I'm a rheumatologist by training. I've done lots of other things as well. I was an osteopath before I became a doctor. I've got some training in acupuncture and more recently pain management and women's health. So I've got all sorts of interests, and my role with the charity is to be the medical advisor, which basically means I make sure the charity says things that are correct and evidence-based.
Excellent. And you do a wonderful job as well, I might add. So let's jump into the unusual history of arthritis. So what was the earliest treatment that you know of for arthritis?
Okay, so I wanted to just talk a little bit about the history of arthritis, actually, first, if that's right.
Of course,
with you,
please.
Marc, because it's really interesting. So arthritis really goes back to the dinosaur times, and they have found evidence that there are dinosaurs from about 150 million years ago that had problems with their jaw, for example. So evidence of an arthritis that was like equivalent to our kind of gout, which is really, really, really fascinating.
Is that all the red meat they're eating?
Who knows? Exactly. Neanderthal remains have certainly shown evidence of osteoarthritis in the spine. So that obviously goes back hundreds of thousands of years. The first evidence actually of rheumatoid arthritis, which is, as most people will know, is a different kind of arthritis, was found in the Native Americans about 4,500 years ago. And it was not found in Western societies really until after Christopher Columbus went to America and started to do the exploration. So there came this theory that perhaps rheumatoid arthritis came from some form of infectious agent, because it was only really found in Europe from about 1500, which is really interesting. And there is thought to be a link between arthritis and the microbiome, which is a hot topic at the moment. And it's postulated that rheumatoid arthritis may have been caused by an infectious agent brought from the New World to the Old World, possibly contributed to by the diet that we were eating at the time, which is really, really interesting. So that's a interesting fact. So very interestingly, the ancient Egyptians knew of gout, and they used to treat it at the time with crocus extract. And crocus extract is what makes up a drug that we use for acute gout now, called colchicine, which is very interesting. So there is some truth in many sort of folk or herbal remedies. So your original question, Marc, was about earliest treatments for gout, really. So I suppose crocus would be one of the earliest treatments for gout. For many years also people knew about willow bark, which contains the precursor of aspirin. So people used to munch on a bit of willow bark as a remedy for fevers and pain. And then in 1897, Bayer extracted the active ingredient from willow bark, which is salicylic acid, and turned it into aspirin, which was one of the world's first, if not the first, commercially produced medication for inflammatory arthritis.
Wow.
So that was the first one, probably. Aspirin was probably the first commercial drug for arthritis. In the early 1900s, they used to think that rheumatoid arthritis was caused by an infection which potentially it could be with environmental agents put on top of that. But around that time in the 1930s, they were experimenting with the use of heavy metals in the various infections. So, for example, they discovered that if you put gold in a TB culture in the lab, the TB would be killed. So they suddenly thought, oh, why don't we try gold as a remedy for arthritis then? If arthritis is caused by an infection, let's just try a few different things. And so they started experimenting with injecting gold, and that in effect that was actually an effective treatment for arthritis, and in fact is still used for a few people. I can remember that when I was at school, one of my friends' mums had severe rheumatoid arthritis, and she was treated with gold injections. That was the only treatment available really at the time for severe arthritis, but it's still used and still a very effective treatment, albeit with some side effects.
A question about that one. Obviously, in my head, I'm picturing something that's probably not accurate when you say people are injecting gold. So I'm assuming you're not like, how much gold is in there? You're not like smelting down a ring and injecting it.
No. This is a really interesting fact. So an observation was made as well that people who were wearing their wedding band didn't develop arthritis in that finger so much. So tiny amounts of gold were being absorbed through the skin. Now it's not actual literal gold that is injected. It's gold salts. So there's a tiny amount of gold in there. But in fact, people that were treated with gold for many, many decades did develop a kind of goldish tinge to their skin. So they didn't literally turn gold, but they sort of did turn a slightly odd colour.
Maybe I shouldn't have got a silver wedding ring. I should have got a gold one.
Definitely.
So when did the treatment of arthritis start to become commonplace then? So you've already mentioned like aspirin went into like mass production.
Yeah, exactly. So really until about the 1950s, I suppose 1948, guy called Hench and his colleagues discovered that if they injected an extract of adrenal gland, and the adrenal glands are the glands in the body that make steroid hormones and other hormones. So an extract of adrenal gland was injected into people with arthritis, basically cured them. And that was the prototype of corticosteroids. And that was really the first really effective treatment for arthritis. Obviously, steroids are associated with all sorts of long-term side effects, but here Hench and his colleague won a Nobel Prize for his discovery of steroids in 1950, and they have gone on to become, still a mainstay of the treatment for all types of arthritis, and very, very useful in emergencies, literally life-saving drugs for many people. And they're still used for joint injections and to treat flares of arthritis. So that's a good treatment for symptoms and to calm down a flare. Still, in terms of the more conventional medications that we use, so methotrexate is a drug that you may have heard of, and that is a disease modifying drug, and that was starting to come into use around the 1950s. It was originally discovered as a chemotherapy drug, but in much, 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 much lower doses. It's very, very useful and is now called the anchor drug in rheumatoid arthritis because it's used so often. And that is a drug that will prevent joint damage if it's started early enough. So that drug is still the cornerstone really of modern arthritis treatment. In the olden days, what do I mean by the olden days? I suppose I mean before around about the 1980s, 1990s, it was still thought that methotrexate was quite a poisonous drug, and it was used really later on in treatment. But we now know that in fact it's a very safe drug, even though most people don't like taking it. It's a safe drug. And it's used much, much earlier on. Rheumatologists used to use this thing that they called the pyramid approach, where they would initially treat people with arthritis with quite mild drugs. And then if it became more severe, then they would escalate the treatment. But we now know that's completely the wrong way to do it. It should, in fact, be the other way around. So when somebody comes in with active inflammation in their joints, we should hit them hard at the beginning with drugs like methotrexate to get things under control, and then they will have a much better outcome. So that really, I suppose, modern treatment really started about in the 1990s probably. And then moving into the 2000s, we started to have newer drugs called biologic drugs, and those are drugs that are much more targeted drugs of the immune system. And the first biologics were really available about 2001. So that's the story, I suppose, of arthritis treatment, really. And obviously, the mainstay of treatment is still methotrexate, and we still use anti-inflammatories that have been derived from aspirin along the way. They're very similar. They work in a very similar way to control pain and inflammations. That's inflammatory arthritis.
Mm.
In terms of osteoarthritis, then similarly, people would have had things like aspirin in the olden days and anti-inflammatories, and then later on things like codeine and opioids, and you will know all about the opioid crisis. So we know now that opioids are not really a very good treatment at all for chronic pain, in particular in osteoarthritis. So now we're moving away from those drugs quite a bit more, but still use anti-inflammatories.
So let's go. So we'll stray away from medication for a little bit now. That was a very concise rundown. So with what about, so like one of the things that's still used like today is like things like splints and supports.
Yeah.
And I remember from your talk that there were some very interesting versions of them back in the day.
Yeah, absolutely. So orthotics and splinting and things like that goes back thousands and thousands of years. We're not talking about artificial limbs, but certainly artificial limbs have been found in Roman remains, and amputation was the first surgical procedure, really, and not necessarily for arthritis, but it was the first surgery really that was offered. And there are all kinds of splints that have been used over the years, ranging from, in the olden days, bandages soaked in horse's blood to kind of form a thick, whatever, which sounds absolutely revolting, doesn't it? To form a kind of thick and sort of stiff coating that to put round joints, various poultices, of course, through the years. Splints to I don't know if we would call it a splint, but there have been gadgets designed to straighten spines. A curved spine is called a scoliosis, and in these days, scoliosis is managed with surgical treatment to correct the curvature of the spine. But in the olden days, there's no surgery for this procedure, and so patients used to be fastened into a kind of chair with a kind of contraption like a harness that would literally stretch them like a torture kind of chamber, where they would try and have their spine stretched back into place. I'm not convinced it actually worked, but I suppose that at least they felt they were doing something. And then there were obviously little splints for fingers, like as we saw with the Princess of Wales the other day, who had a finger taped up, didn't she? That's been done for many years.
I like how you mentioned the word, you sort of like took the words out of my mouth when you said like a torture chamber, because some of those pictures, it does look like a medieval torture device, some of those things.
Yeah, absolutely. You would just really literally be pulled until your spine stretched. I don't know if it worked at all. Of course, those were the days of if you broke a bone, you would be lying in bed for weeks and weeks and weeks, and would have a traction device like a Carry-On movie to try and help your bones to heal.
I always find that so interesting. Like the old advice for everything was basically just to lie in bed and not do anything.
Absolutely. And these days, if you break your hip, you're up, literally the moment you wake up, you're up and out of bed and through that hospital door within 24 hours, if at all possible.
What about, and obviously this is something that I still know is used there, like hydrotherapy, especially these days, is incredibly popular. And like a lot of people do talk about hydrotherapy.
Yeah, it is. So water is really soothing. Lots of people say that warm water is good for their joints, and it's nice just to sit there and relax, of course. And hydrotherapy is one of the most ancient forms of treatment, of course. So I suppose in the UK this was probably pioneered in Bath, where it was the National Mineral Hospital, affectionately called the Min in Bath, and that started up around 1740, and people used to go to Bath to take the waters. And that generally meant trolley. It was meant for there was no NHS, obviously, but it was for poor people who were into trouble. Basically, they were allowed to go along to the mineral water hospital, and they found great benefits from taking the water, literally taking the water, drinking the water, and lying in the water, and it's warm water in Bath. And it's one really interesting thing is that around those days there was a condition which was called the dry bellyache, and that was often found in sailors who used to sail to the Caribbean, and they drank a lot of rum that contained lead at the time. And what lead poisoning does is it gives you a very bad stomach ache and it causes paralysis. And so some of these sailors used to come back and go to the mineral water hospital and sit immersed in warm water. And the effects of the warm water were to sort of help the lead to be excreted from their body, if you like. And so after a year or so of sitting in this lovely water, they recovered from their paralysis. So there were some fantastic stories of paralyzed people going there and then literally getting out of their bed at some point. And of course, they were also fed a really healthy diet, and they were exposed to sunlight. So conditions like rickets, which was vitamin D deficiency, would also be benefited from a healthy diet and some sunshine. So there is some truth that going to take the waters at Bath would be helpful. And of course, there they pioneered sort of hydrotherapy for people with all sorts of arthritis in the olden days when people had rheumatoid arthritis. This is before steroids, when there were no treatments. It was very soothing for people to go into the water and have their limbs moved and improve their range of movement, and of course help with the pain. And still hydrotherapy, unfortunately, COVID has done for a lot of hydrotherapy units these days. But many people absolutely love doing hydrotherapy and being in the warm water to this day, and it's very helpful to improve mobility, especially if you have trouble weight bearing on your painful joints.
Definitely. Yeah. Something that I know loads of people that if they come to our groups and stuff, they've all, loads of them have so many good things to say about like just being in warm water in general and just how good it makes the body feel.
Yeah, absolutely.
Were these in like these sort of old baths you're talking about in Bath, ironically, were they all just like group, like, big like communal baths for it, or these are just like individual tanks?
Yeah, they have. If you go to Bath now, I mean, the Roman baths are still there, so they have like big sort of swimming pooly type areas. But they also had a kind of hydrotherapy where they sprayed people with cold water, which is a bit more brutal. So they had these sort of giant pressure hoses, and the poor person would stand there shivering in their underwear and be sprayed with a cold hose. And I mean, that's an interesting one, isn't it? Because it was like an equivalent, I suppose, to cold water therapy, which everyone is doing these days, isn't it? So it sort of certainly woke you up and made you feel a bit brighter, but I don't know if I'd like to do it.
What was the thinking behind just completely just blasting someone with like a fire hose, essentially?
I have no idea. It seems like a punishment, doesn't it? But I suppose that there's this thing where you use, for example, if you're injured, sometimes if you put hot and cold on an injury, that can make it feel better, can't it? So the alternate constriction and relaxation of the circulation can be soothing. And I think if you have ever jumped into cold water, you know what that diving reflex feels like, and it feels like a real shock. But after that, if you can stand it for a while, you get a kind of elation from that feeling. Somehow resets the brain. So maybe they were just doing it because they'd experienced that themselves from cold water immersion in the sea or something.
There's another type of bath that I remember you mentioning, which is radium baths.
Yeah, this is another really interesting thing. And do you know there are still radium baths in Europe and in the US? There is something called the Radium Palace Hotel in the Czech Republic, and there is a Radium Hotel in Montana in the US to this day. And these are places, spa towns and spa hotels in a location where there used to be a uranium mine, and radium is a radioactive isotope. It comes from the breakdown of uranium, and people found that if they went to sit in one of these mines, some of their aches and pains went away, which I think may well be. It's not exactly evidence-based, but I think it may well be useful because people still swear by this. But obviously, radium is a very toxic element.
That's what I was going to bring up.
Yes, it's absolutely. It's quite shocking, isn't it? It killed Marie Curie, obviously, but she was obviously handling a lot of radium, but it killed her. But you can still go to these places and inhale radium, which is a shocker, because statistics show that radium is only second to cigarette smoking for causing lung cancer. And you can bath in the radium waters and drink the water, obviously. I thought this was a historical thing, but it isn't. It's still actually used, and it was used to be more widespread in the US, and people used to go and fill a little box of soil with this uranium-rich soil and sit with their feet in the soil to help their arthritic aches and pains, and sit with a box of this stuff on their tummies to help with tummy ache and things like that. So, still around.
That absolutely blows my mind.
I know. I don't know if I'd want to go there on holiday, but you can if you want. Can if you want to. Yeah. But interestingly, ankylosing spondylitis, which is a condition that causes fusion of the spine, one of the very old-fashioned medical treatments for that was X-ray treatment of the spine, which was effective to help with pain. So maybe if you've got that kind of a condition, it might well give you some benefit.
Wow. Okay.
Yeah.
So I'm still just like
I know.
I'm still shocked to all
I'm
this.
gobsmacked. You can actually book these hotels on the hotel booking website.
I mean, do they get much repeat business, or is everyone just going off
I don't know.
various types of poisoning?
Yeah, absolutely. You wouldn't think I'm going to uranium mine for my holiday this year.
Wow. I guess there's a whole new brand of tourism out there.
Yeah, definitely.
Okay, right. Speaking of another sort of like weird one then. So this is one that I was also shocked and not shocked, knowing just how crazy the world is.
Yeah.
But wasn't there a type of cure for arthritis involving whales, the creature, not the country?
There was. This is such a funny story. I couldn't stop laughing when I first found out about this. So the story was reported in the New York Times around about 1896 that a dead whale had pitched up somewhere in Australia, in New South Wales somewhere, and a fella that was rather the worse for wear after a night on the town was staggering along the harbour, and he was full of aches and pains, and he accidentally fell into this rotting carcass of the whale, and he woke up the next morning hangover free, and apparently jumped out of this whale skipping and dancing and saying all his aches and pains had been cured. So this was widely publicised, and from that moment people used to go to Australia from all over the place to take the whale cure. So they used to take in all these whale carcasses once they've done what they were doing with them. They used to drag them into the harbour, dig a little hole inside the whale, and you had to sit immersed in this whale up to your neck, and inhaling all these rotting whale fumes for 30 hours.
That's how it was 30 hours.
It was 30 hours. And then you came out and you were feeling a hell of a lot better. But I think after sitting there for 30 hours, you probably say you were feeling better so that you could get out of the whale. So it hasn't become a conventional remedy yet.
And for the whale's sake, I'm very glad. That doesn't feel like a very sustainable treatment for the world.
Not really.
I do have questions about the logistics of how that works, though. I don't know if you know how much you know about it, but so would they drill a hole per person, or was it just everyone would tunnel in and huddle in inside?
That's a good question. I don't know if there was more than one at a time. I suppose there could be. If it was a big whale, I suppose they'd make it would be like a little bus, and everyone would be sitting there.
That's what I'm picturing. It's just slotting a couple of benches in there and make it like a really grotesque sauna.
Exactly.
Well, I'm glad that one's not around, to be honest.
Yeah.
Okay, so right, let's go to surgery now. Then, now that we've covered the obvious whale side of things,
yeah.
What were some of the older surgical treatments, and also part two of the question: how do they differ from today, if at all?
Yeah. So surgery. As I said earlier, the earliest surgical procedures for, obviously mostly for injuries, would have been amputations of limbs, and they certainly have found lower limbs in Pompeii, for example. There was a bronze lower limb that was discovered, but all of the amputations were done at a time before anyone knew anything about anatomy at all. So nobody knew about the circulation or the veins or the arteries until around about the 1700s. So all these very early amputations were very much very brutal affairs, where the wound was sealed either with something like tar or with boiling oils. It must have been unbelievably agony to have this done in the olden days. Obviously not commonplace to have that done for arthritis, but for very painful conditions it would certainly have been done. In terms of joint replacements, these were really started around about the 1890s. So the first joint replacements were done by a German fella who called Gluck, I think his name was, who used an ivory joint replacement on the knee of a young girl who'd had an infection, a TB infection in her knee, and that worked quite successfully. So the earliest joint replacement surgeries were done using ivory, which was a fairly inert sort of substance that the body could tolerate quite well. But unfortunately, most of the early joint replacements were done on joints where there was infection. So TB, tuberculosis, is an infection that can affect the joints in a very serious kind of way. And so invariably these joint replacements failed because there's still infection inside there. And of course, this was a time before antibiotics. So the first joints replacements were very unsuccessful. So these really moved on through all the way through the 1930s, 1940s. And then once there were effective antibiotics after about the 1940s, then modern joint replacements were designed using things like polythene and metal, to the titanium in particular, that were much stronger and much more durable. And of course, most people undergoing orthopedic procedures these days will have a shot of antibiotics around the time to prevent any kind of joint infection subsequently, because that will lead to the joint failing. So that's the story, really. All sorts of joint replacements have been done through the years, and techniques are now very, very sophisticated. And there is work ongoing about 3D printing of replacements that can be completely customized. Most joint replacements are done off the shelf, of course, but if you can customize one that looks exactly like the other hip, then you're much more likely to get a better result. So modern technology can help with that. And now many joints can be replaced. So ankles, for example, elbows, even little finger joints can now be replaced, and the technology is improving all the time. Luckily, infection now remains a rarity after joint replacement surgery.
Excellent. So with the materials and everything as well, I don't know if it was from you or from somewhere else, I heard like the ivory ones actually did last really well and were quite good.
They absolutely did. Yes, there was a woman who had I'm not quite sure, I can't remember where she came from, but there was a woman who'd had an ivory joint replacement that lasted 30 or 40 years. And it was so good that she had an x-ray done when her other hip wore out, and you could still see the ivory when she was due to have her other hip replaced with metal. So they did last very well for some people.
Oh, also she had one metal and one ivory hip.
Yeah, exactly.
Just then a race to see which one deteriorates most.
Yeah, and the ivory was still working.
Amazing. I mean, again, not a sustainable one. Let's not do that.
Probably not, no.
3D printing sounds much more.
Yeah.
Sounds very interesting. No, I didn't know about that. Right. So that's most of the questions I have for you now, except for a little kind of bonus thing. So I've been on the internet.
Oh dear.
The wonderful internet, to find out what nonsense I could find out there.
Okay.
I thought I'd throw a few cures like that people have claimed for arthritis, and you can tell me if they're like real or rubbish.
Go for it.
Number one, bee stings.
Oh, interesting one. Very interesting one. I'm a beekeeper.
Are you?
And it really, really hurts when a bee stings you. And there's a lot of local inflammation that goes on around a bee sting. And I don't know if this is evidence-based or not, but lots of I've certainly met people who've there is a treatment that you can get where you buy some bees and you make them sting you in your painful joints. I don't know if that works for inflammation or not, but once the bee stings you, it generates an inflammatory response that causes blood flow to the area, and maybe that releases healing substances that can perhaps help pain. It might be something similar to when when you're a child and you injure yourself and you rub it better. So you can only really experience one pain at a time. So your worst pain will be experienced. So if a bee stung you on the cheek, say, you would feel that, and you wouldn't feel it in your joints because your brain gets distracted. So it may just be that your brain is switched off from the original pain. If you have some bee stings, obviously you've got to be careful if you're allergic. So you may not know that until you've bought the bees.
approach that one with caution. Let's maybe not
Definitely.
advise that one then.
No, I'm not recommending that.
Number 2, copper bracelets.
Okay, yes, loads of people wear copper bracelets, don't they? There is absolutely no evidence that copper bracelets make any difference at all for arthritis. People swear by it, but if it's the kind of thing where if you believe it's going to work, it will work. So if you think it's going to work, go for it. No evidence that copper gets into the blood, however, from a bracelet, so it can't work.
Okay. Gin-soaked raisins.
Wow, that's a good one.
It'd be fun if nothing else, even if it doesn't work.
That sounds like something. That sounds like something from that Roald Dahl book where he killed the pheasants. Um, no evidence for that. Obviously, gin is an alcohol, and if you eat enough of those gin raisins, you'll feel a little bit happier potentially, but not a solution for arthritis. And longer term, alcohol is very bad for your sleep.
I imagine this next one might also have similar issues, a lot more, in fact. Snake venom.
That's an interesting one. So yeah, in the olden days, everyone used to go around selling snake oil, which is different to snake venom, isn't it? There is I think it's called the Chinese water snake, does have in its skin something, it has omega-3. So what would be called omega-3 fish oils, but it's obviously omega-3 oils that are in the snake skin, which might help some people with arthritis, but that's not the same as a snake venom. Obviously, snake venom is a toxin. I don't think there's any good evidence that will work, and obviously could be dangerous.
It sounds like a really bad trial and error situation there.
I would definitely not want to try that, no.
This is a much gentler one next then. So, WD-40. Not joking. Loads of people on the internet claim it works.
And then what do you do with it? You meant to drink it or spray it on?
That I don't think anyone seems to be able to agree on.
Wow. That sounds like drinking bleach for COVID. Not at all a good idea.
Exactly. Yeah.
I wonder if perhaps if when it comes out, if it comes out cool, it might cool the joints a little bit. If you spray it on your joints. I mean, obviously WD-40 is not going to go inside the joints if you spray it on the skin. And it's certain. I suppose the idea behind that is that it will lubricate the joints, which it won't do, but it might. No. Putting a spray on it might help with pain.
Yeah, so I was also wondering if maybe it was like by rubbing the oil in, like actually it's the massage or the sort of the palpation of the tissue might actually be what worked.
Great point. Yeah,
they could just do it without the WD-40.
Agree. Rubbing is very soothing.
And last one, leeches.
Leeches is an interesting one, isn't it? Yeah, leeches actually. I don't know if it's the saliva or what, but when a leech bites you, it excretes an anticoagulant, so a substance that will stop the blood from clotting, and so that the blood can flow into the leech. And historically, bloodletting's been used as a cure for arthritis, but generally when doctors tried an old-fashioned cure for arthritis, what they used to do was to write what happened in their notebooks, and after a year or so bloodletting, it said it didn't work. So I don't think leeches will work either.
Okay, well, so I mean that's a pretty unsuccessful list.
Yeah, exactly.
The internet has not done us well there.
No, quite not very well there.
Maybe we'll stick to doing things like listening to your doctor or something like that.
Maybe, but lifestyle advice is very, very, very important, and staying active and reducing stress and sleeping and all those kind of things are really, really important as well for boosting our immune system and trying to prevent arthritis in the first place. Any
final words on that then, Wendy? Anything else you'd like to bring up for it, or have we covered the unusual history?
We have covered everything. There's some really interesting if you ever go to Bath, it's a really very interesting place to go and see the Bath Museum, the Museum of the Mineral Hospital. Some very interesting things there to see what they used to do and what they're still doing.
I've been past Bath on the train on the way to Bristol several times. It looks lovely, and I always think that whenever I go past, I should really stop there one day. So maybe I will. I'll make a point of stopping there.
It's a really, really interesting place. Yeah.
Well, thank you so much, Wendy. That's been really interesting. I really enjoyed that.
Brilliant. That was good fun.
So, should anyone want any more information or to follow up on any of our resources? And we've also got like a few webinars as well featuring Wendy as well, should anyone want to hear a bit more from her. So you can find them on our website, which is www.arthritisaction.org.uk. Or if you have any questions or anything you'd like to comment on, please feel free to email us at podcast@arthritisaction.org.uk. And that's us done for today. Thank you very much, Wendy.
Thank you.
Thanks, everybody. Bye-bye.